Warning. This video may contain information that might challenge your medical belief system. Viewer discretion is advised.
Degenerative disc disease. Today we're going to be talking about the biggest myth when patients come to my office and ask me what's going on with their disc and why it's getting worse over time, and how we can debunk this and help you make sure that your discs don't go through the same process that everybody else's does. We're going to show you some patients that have older spines that have perfectly healthy discs, and some patients that are younger that their discs are actually degenerating at a rapid pace, and what you can do to actually help fix these things. So the biggest thing is we're going to talk about the structure of your spine and things that we need to correct to make sure that we can actually prevent this process from getting worse with time. So let's talk about it. What is the biggest myth surrounding degenerative disc disease? Well, patients come in my office and they have been told by all their primaries or medical doctors that this is something that's happening to them just because they're getting older, which could not be any further from the truth. The thing is, it is a complementing factor where if you leave a vertebrae compressed and it degenerates over time, it can get worse as you age. But I'm going to show you examples of patients that are older with healthier looking spines than patients that are younger, and it actually has to do a lot with the structure of their spine and their quality of lifestyle that they're living. That can actually degenerate the disc, make it worse faster, and it's different for everybody. It's not just based on age. Another reason why that's going to be important is because when I show you patients that have disc degeneration in their spine, you're going to notice that only one or two of their discs are degenerating or being compressed. If it was related with age, then we would be seeing every single vertebrae in their spine degenerating, and that's not the case. So let's go ahead and jump into that right now. So this is going to be very important as you age. If your discs are getting smaller with time because we're not taking care of our spinal health, you could actually start to lose height, and that is actually linked with increased mortality rates. The more height you lose at a more rapid pace as you get older, you can actually be taking years off your life. Because if the discs continue to get smaller as you have that accrued pressure on those joints, you're going to be adding more pressure to the nerve in which comes out this foramen. That nerve pressure right there can be creating symptoms not just of neck pain or lower back pain, but over time it can actually affect how your organs function too. If you are losing disc height, that right now you have to be taking those immediate steps to actually preventing that from getting worse and building on getting your health back. And don't think because you're getting older that this is impossible. I'm going to show you study after study of people at older ages, 50 and above, that are actually not just stopping degenerative disc disease, but actually getting their disc spacing back through chiropractic care and physical therapy. So here's a perfect example. We have a patient right here where he's lost the curvature in his neck. He's been playing sports his entire life, and he actually has damage right in the middle of his neck. So when you look at this x-ray, and we're looking at the disc, you can see healthy spacings between these joints, but right here at that C5 and C6, you can see that that's more severely compressed. The biggest thing is when you don't have a curvature in your neck like this, it's going to be all the weight from your head and that loss of curvature that's going to be compressing that and pushing the nutrients out of the disc. Therefore, it's going to actually accelerate that degenerative process. But then with this patient, it actually was related with 2 concussions that they had playing sports. I know this because that was me. So this is another patient relatively the same age who's also been in a motor vehicle accident, but has a great C-shaped curve, had a great C-shaped curve before the motor accident. So when you look at this image, the red dots are tracing the posterior longitudinal ligaments, which will hold the vertebrae in place. And it's all well maintained, all well intact, and the vertebrae, the discs themselves, are all well intact as well. So no damage, even with previous whiplash injury, maintaining that structure of the spine has made sure that his spine has not degenerated over time. So here's another example of a patient that's had a loss of curvature their entire life. By their mid-50s, they've already had arthritis that they've been told from a doctor their spine now looks like an 80-year-old's. You can actually see that there's arthritis of this bone spurring all throughout the C4 through C7. The disc spacings are basically not even there anymore. The vertebrae are basically fusing together, and the patient can no longer have that full range of motion of turning their head left and right. So that's why it's so important at an earlier age, if you have a straight neck, that you work on correcting this. So one of the reasons we tell our patients why it's very important to take care of your spine even after a corrective care plan is that if you have a misaligned vertebrae and it stays misaligned for longer than 2 weeks, you can actually start down this degeneration process, which actually leads to not just degenerative disc disease, but that early arthritis, osteoarthritis, and bone spurring. So you'll see that in these studies here, and even one of them is backed by a medical doctor back in the early 2000s. So here's an x-ray of another patient that's in her mid-60s. When you look at her spine, she's been told that she has degenerative disc disease just because she's getting older. But when you look at her x-ray, you can actually see that the C4 disc, the C3 disc, and the C5 disc are compressing and are degenerating with time. But when we look at it even further, the only reason why those three vertebrae are affected the most is because the ligaments are damaged. We actually have a retrolisthesis, the vertebrae shifting back into the spinal canal and creating weakness there. Therefore, that with time is actually what's creating that degeneration in that specific area of her spine. If it had to do with the fact that she was just getting older, then we would have seen a degenerative disc right here at C2, at C6, and C7 as well. And that's not the case. So this is a perfect example that shows you it's more dependent on previous injury or damage to your spine, also the structure of your spine, and that is going to be in accompany with time, not just due to the fact that you're getting older and more. So here's an x-ray of a patient that's been coming to my office for the last 7 or 8 years, has been getting chiropractic care. She's in her early 60s, and you can see she actually has a really great C-shaped curvature in her neck. Could it be a little bit better than what it is right now? Absolutely. But being in her 60s, would you expect to see some degeneration of her spine? Sure, there's maybe a little bit of arthritis, a little bit of degeneration right there, but when you can maintain that C-shaped curvature in your neck and take good care of yourself, you can see that all the disc spacing in between those vertebrae are all pretty much well maintained. Once again, this is another example that shows why as you get older, your discs do not have to degenerate. So one very cool thing I want you guys to see is that there's articles after articles that actually show how patients have not only been able to stop degeneration of their disc, but it's not actually dependent on their age. You can see some of these studies are from people in their 50s, their 60s, or even their 80s. So when we're talking about this, there are going to be some limitations though for every individual. It's not the fact that you're going to get older, all your discs are going to stay well maintained. There is such a thing called limitation of matter. What does that mean? It means as you get older, your body isn't going to be healing as well as it used to. On top of that, your body isn't going to be able to keep those nutrients inside those discs. So there is going to be some part of the disc that can get smaller as you do get older, but not to the point of where we're going to actually label that degenerative disc disease. So that is something that's very important to note, that it is going to be something that can get worse with time, but as long as you keep maintaining your health and you keep working at your spinal health, that's going to be the biggest indicator of why one person degenerates and they actually get that older looking spine as they continue to age, and the other person continues to live their highest and best quality of life. So when it comes to the medical model being able to help you with degenerative disc disease, you only have a couple options. Number one is that you can take medications for the pain. But as we know, that's just only going to be masking the cause of the problem, and it's never going to be getting straight to the root of the issue. The next thing you can be doing is something like cortisone injections, which might be a little bit even more effective because they can do injections directly into the joints, but they might only last for so long, and the more and more you do it, it actually becomes less effective over time. The third option you can do is potentially even a surgery for some of these issues if your pain gets that severe. But I don't know about you, but for me, I think surgery should always be the last option that a person takes for their health. So just keep that in consideration, that there are some other holistic ways for doing that. And then lastly, there's the do nothing approach. But as we know, if we do nothing, does anything ever really get better? So that's why it's really important, if not take a chiropractic approach to these problems, also take a physical therapy approach, and even together, that's when we can get the best results for our patients. So let's say now you lost the curvature in your neck, and all that weight from your head is pushing down on a specific joint in your spine. And that disc is actually starting to degenerate like we've been talking about throughout this entire video. Why this can actually get worse as you get older and actually can increase over time is because as that disc gets smaller, you're gonna see that the spacing between the bones actually gets smaller too. And since your body, it has this protective response called Wolff's Law, it's gonna eventually then lay down calcium to make sure that that joint doesn't become unstable. What that means is as a disc degenerates, the vertebrae can actually shift. And that can put pressure on the ligaments, which then can create spasms and cause nerve pressure. So if that happens, that degenerative disc can actually start building osteoarthritis, which is that bone spurring that you'll see on an x-ray. And then when you start building the bone spurs or the calcium on that joint, now you're adding more weight to the disc. So not only are we losing the nutrients, they're getting pushed out, you have that pressure on the joint, but now you're adding increased weight due to more calcium building on the joint. Therefore, you can even accelerate the degenerative process, which is gonna make you lose height even at a more increased rate. So this is why chiropractic adjustments help out with this, because the more you can take stress off the joint through chiropractic adjustments and keep your range of motion within these joints, you can actually halt that degenerative process and get that that fluid back in those discs and actually help your body move in the right direction. So even though all this information is fantastic, you can actually take it and throw it directly in the trash. The reason being is that there's so much more important information that we've shared with you on this channel, especially in this video right here. So if we don't start applying these things, then none of this is really going to matter. So it's going to be up to you guys to have to make that decision for yourself.